Okay, good morning. We're going to talk about Dr. Gunson's hepatitis C testing of blood donations in the late 80s. Now, hi. So, Dr. Gunson was the head of the UK Transfusion Service. He estimated in 1986 that UK transfusions were infecting 22,500 people, patients via surgery every year. And this report, called the Gunson Report, was sent to all the transfusion directorates, explaining the extreme severity of the problem. And my previous YouTube video covers his report of 1986. What we're going to do today is, you can see here, he says, possibly a more accurate assessment should and could be made. So naturally, this guy running our transfusion service swung into action. From 1987 to 88, he invested millions of pounds, tens of thousands of man-years across the nation to confirm that this level of infections was happening every year. He estimated an attack rate of 3% per transfusion. So about 1 in 33 patients were coming down with Hep C after their surgery with blood. And this, with 4 units of blood per transfusion, means that the blood was 0.75% positive for Hep C. So 4 units at units 0.75 infectious with Hep C is 3%. That's the math. Then he goes on, and the way that he worked the study was, he decided to do 10,000 hepatitis C tests in 3 locations. He went for Manchester, London, and Bristol. And this gives an overview of the British population of donors. You're looking at urban, and Bristol was more rural. You're looking at a north and a south study to cover the nation to see how much of our donations are carrying Hep C. And this is the actual report. It was published in 1989 on the results of the 10,000 samples of donations that he tested for Hep C. He begins his report with an overview of the problem of post-transfusion hepatitis. And you can see he's pointing out that it was very well known post-war that a percentage of patients kind of went yellow after a transfusion and showed signs of hepatitis. Now, during the 70s and early 80s, they'd managed to exclude about 30% of post-transfusion hepatitis. They'd found that 25% of cases were Hep B, with the Hep B test that was invented in 1970. Then there was the Hep A test, the cytomegalovirus test, and the Epstein-Barr test. So they were able to exclude 30% of post-transfusion hepatitis with testing, but they noticed that about 70% of people were still going yellow post-transfusion. And it was always accepted through the 70s and 80s that this seems to be Hep C, non-A, non-B, as it was called. And so he's giving us that background in his report when he starts, that we're testing to see if this 70% of people who go in yellow after transfusion, if it's Hep C that's causing it. Now, he went to Ortho Clinical Diagnostics, a company that was manufacturing at the time the brand new hepatitis C test in 1988. then he ordered in tens of thousands of the new Hep C test to check his blood donation samples with. The test was using the breakthrough of the Chiron Corp, who had isolated the Hep C virus. All the testing, he got thousands of samples from around England, but they brought them all to Colindale to do the testing. They tested them all in Colindale to see the levels of hepatitis C. Now, basically they went for 3,036 London donations, 3,014 Bristol donations, and 3,691 donations from the Manchester branch. So a vast sample, a definitive amount. He wants the best estimate backed up by hard testing science. Not a model, but this is how much there is in the blood supply. And off he goes and does it. Basically, in the study, they tested every donation twice for hepatitis C. To absolutely confirm it was there. This test was first generation, so there was a 5-10% wobble on its accuracy, just getting better. And all the testing in Colindale was done by October of 1989. It's important to realize that this hepatitis C testing system was acceptably user-friendly, as he said, and the first report on screening of UK donors for Hep C did serve as a basis for the implementation of screening all blood. The ELISA test is the one we still use today in a slightly improved format. So, he's using a great test that went on to become what cleaned Hep C out of the world's blood supply. It's a very good test. And these are the results. And, deep breath and study these and think of them deeply. There is no need for a statistics team to model or guess how many people were infected with hepatitis C. You don't dream up numbers. You read this report. This tells us it's the tests on the donations that explain how infected with Hep C they were, and therefore how infected patients were. It's settled science, hard science we call it. Now, let's begin. In London, the blood donations that were given in 1987, 1988, tested altogether over 1% Hep C positive. So if you times them by 4 units of transfusion, about 1 in 25 surgeries with blood in London was giving someone Hep C. Serious fact. On the repeat reactive, so they test the sample yet again, they found it was 0.83. And so even at that level, you're looking at about 1 in 32 surgeries with blood would then give a patient in London hepatitis C. And do remember that we're looking at thousands, 3,000 samples being tested. So a vast number. This figure is as close to accurate as we'll ever get. In the Bristol Regional Transfusion Centre, if you look at it, less. Obviously, rurally areas. Bristol's drawing a lot from around Bristol. It's a smaller city, more countryside people were donating. And they found that it was 0.52% of the donations had Hep C in them. So maybe 1 in 50 transfusions in that area would give somebody hepatitis C. And when they repeated their test, it went down to 0.36, perhaps 1 in 60 or 70 surgeries with blood would give someone hepatitis C. Finally, in Manchester, we're noticing again about 1% of donations had hepatitis C, which is about right. 1% of the population had Hep C at this time. And again, you're looking at about 1% positive blood supply, using 4 units per surgery. 1 in 25 people would get Hep C. The repeat reactive testing on the Manchester donations was 0.68, which would be more like 1 in 35, 40 transfusions transmit Hep C. So totaling up all of the UK's regions, north, south, urban, rural, this study then came to totals. If we look at the totals, we notice that initially they're 0.86 infectious, and repeating, they're 0.62 infectious. So transfusions across the nation would be coming in at around about 2.5 to 3% Hep C positive. And this is backed up by 20,000 hepatitis C tests done throughout the United Kingdom. The most definitive study. There is no need to try to guess what's the potential numbers of people infected with Hep C from transfusions. What you need to do is publish this report. The transfusion service knew absolutely clearly that this was the level of hepatitis C in its supply in the late 80s. It had estimated it in 1986, and it conclusively proved it by 1989. So Harold had estimated a 0.75 per unit in 1986. And if you do the math between 0.62 and 0.86, which is the initial result and the subsequent secondary test, between 0.62 and 0.86 is 0.74. So he estimated 0.75, and after 20,000 blood tests to check for Hep C in donations, he's come up with 0.74 as a figure in between the repeat testing and the initial testing. It's clear that Harold Gunson, director of the National Transfusion Service, was very good at his job. There's a reason why this genius helped in purifying Hep C out of the blood supply across the European Union and became the head of the International Society of Blood Transfusion. Guy knew what he was doing. His numbers are not in question. So again, even at the lowest level, 0.62 per unit of blood with Hep C, we're looking at about 2.5% of UK transfusions, 1 in 40 UK transfusions from 1965 to 1988 would be giving people hepatitis C. It's simple math, and it is done the world over. And it's important with this type of science to keep it simple, stupid. 2.5% of 750,000 transfusions a year gives you about 20,000 infections. 20,000 a year for 20 years is 400,000 people transfused hepatitis C in the United Kingdom. And there it is, his initial estimation, backed up by hard science and millions spent, tens of thousands of man hours of testing done. Moving on, 2.5% of the 750,000 transfusions is exactly 18,750 cases, still happening, 1988, 1989. Moving on. So, after a year of testing 9,684 donor samples for Hep C, the UK transfusion was highly aware that transfusions were between 1 in 40, 1 in 35 positive for Hep C. It was highly aware that it had been like that going back through the early 80s, the 70s, the 60s. It knew this fact. And imagine the shock when it really dawned on them that, whoa, Hep C is an incurable, deadly carcinogen. And it's going to be killing 10% of these people. It's a serious kind of revelation moment for them when they realise this. There needs to be a level of sympathy for the sort of electric shock that must have gone through the service during the late 80s as it dawned on them the scale of the pandemic. That all over the world, people have been being infected with hepatitis C by surgery, by their doctors, treating them. You know, it wasn't intentional. They didn't have a test to exclude the virus, but the pandemic had happened. Vast numbers across the world, 100 million plus, had received Hep C. So we're looking at about 180,000 from the period 78 to 88, and perhaps 140,000 from 68 to 78. At the time of writing the report, the UK was 1% infected with Hep C, with perhaps 300 to 400,000 NHS survivors. All of this would have been common knowledge to the people in the service who knew what they were doing. And what did they do? What happened after this report, when they just knew that, whoa, the science has settled it, there's been this many infections? What did they do? Well, astonishingly, they launched a cover-up. The simple tragic fact is they rushed to settle out of court with the tiny group that actually knew they'd been infected via NHS care. And that tiny group were mainly the users of factor products. Most people who had post-transfusion hepatitis didn't have radical symptoms. A lot of them thought it was a passing phase. You're pretty ill after major surgery most of the time. The symptoms go away. Very many people who have blood during surgery aren't aware of it. So that's what happened. They rushed to settle out of court in 1990. They bullied this tiny group of haemophiliacs suffering from all the viruses, HIV, Hep C, Hep B, into measly payments to settle it out of court and then progress to just saying it's not really happened. And they divided and ruled. They paid off one group, and the transfusion group, they just covered it up. Even now, we're not told the Ortho Report and the numbers it makes obvious. We're told tiny numbers. Instead of 400,000 infections, we're given figures of 30, 20,000, tiny numbers. And there are three groups affected who are victims of the pandemic and its cover-up. And each of these three groups needs to come together to get the truth and to get justice. If the factor group represent the sheer untold suffering and agony that the transfusion pandemic can cause, the transfusion group represent the sheer scale. This concerns most people, not just a tiny group, but a huge group. How many of us have got appendix scars? How many of us had tonsillectomies? You don't know if they use blood for them. You don't know if you're at risk of 1 in 40, 1 in 30 chance of hepatitis. So it's a everyone problem, not a their problem. And the last thing really is migration. The largest group with infected blood in their veins in the United Kingdom today are people who are arriving. This is not yesterday's news. It's coming over the border today. Do you really think they're testing the blood in Kabul? Do you really think that there are clean syringes free from hepatitis in Kabul? UK maternity units have shown that are Black, Asian, Chinese, Eastern European, North Africa, South Mediterranean, all these communities suffer from larger amounts of infected blood pandemic numbers and infections. So 200,000 people have arrived with the virus in their veins, and they're bumping into this cover-up that kills them. There is no border screening. We don't say, oh, you're from Egypt, 1 in 10 of you have Hep C from healthcare. We test you. We don't act like, say, Switzerland would do that. Germany would do that. When Germany tested migrants from the Syrian wave for Hep B, 2% had Hep B. There weren't clean syringes and transfusions in the Iraq-Syria war zones or Libyan war zones. So all three groups together need to come together and get justice. And to an extent, it's almost as if they don't know each other or even like each other or believe in each other. So the cover-up has done a great job of leaving nearly all of them unaware, untested, dying far more often. And we have great therapies for this thing. It's £10 to test someone for hepatitis. It's approximately 100,000 to give them a liver transplant. And most of them won't survive to get one. Moving on. The question now comes, who runs this cover-up? And what's incredible is there are numerous people who've literally signed the documents, the lies, that, oh, it wasn't 0.6% of donations had Hep C. No. The contribution of transfusion to hepatitis C in England, this document was written by, and you can see here, all of our blood transfusion service directorates. That's the head of every blood transfusion directorate in the UK. And they signed off in this document that transfusion donations were only 0.06 Hep C positive. They actually signed off that the blood was 10 times less Hep C positive than their own blood tests had shown. And these are their names. And look at this closely. Mary Ramsey actually works in Colindale, the very place where 20,000 blood tests proclaimed the blood was 0.6% Hep C positive at the least. And she's signing in this document that it's 10 times less infectious. The same goes for Kate Soldan, working in Colindale, Helen Harris, working in Colindale, and then we have Patricia Hewitt, working in Colindale. This is crazy. The very people who've been working at the venue that found it was 0.6% of our transfusions, of donations have been infectious for decades, the very people are signing off, no, they're not. Now, to think of the scale of this, if I say alcohol is 10 times less dangerous than it is, we probably wouldn't get a warning on the packet. If I said COVID is 10 times less dangerous than it is, well, we would never have even heard of it. People would have said, oh, it's way less dangerous than flu, isn't it? This is what lying means. And they literally have signed their names on this document. And my point is that we need to come down hard on this. We need to cuff, arrest, fingerprint, photograph these individuals and ask them, what were you doing? We are charging you with leaving people in danger. If Mercedes-Benz was selling cars that blew up into flames 1 in 40 of the time, and then they turned around and said, well, it's more like 1 in 400, 500, and oh, they're very low, most of them are scrapped now. That's no. Just no, it's a crime. Now, some of them might have not known what they were doing. Some of them might be, I wasn't there at the time, it was the guy before me. But we have to arrest them and question them. 2,000 people a year were estimated to be dying. And we know that lying to them would kill them far more often. It's that serious. And humbly, they were arrested in France. And they didn't do anything nearly as bad. They lied for a couple of years. These guys have given out these numbers for decades. Moving on. Just when you thought it couldn't get worse, that there are all these doctors who've taken the Hippocratic Oath, they've sworn to protect us, to tell us the truth and do no harm, and then they've juggled the figures and left us all in deadly peril. Just when you thought it couldn't get worse than that, well, it does. Even worse than the transfusion directors not telling the truth. We have the departments of health. This is a missive from the Department of Health in Scotland, but the English Department of Health under Dr. Kenny Cowman, he signed off the UK look-back letter, which is just as flawed. But in 1995, you can see down here, January 1995, it was noticed that, there's media stories. The whole of America is testing everyone who's transfused. The whole of France is testing everyone who's transfused. There's a global campaign, stop, caution, get tested if you had a transfusion. And it hit the newspapers. So they set up a helpline, the Department of Health, to advise people who might be ringing their GP, like, oh my gosh, I had a transfusion. Am I in danger? Can I have a hepatitis C blood test? So what they did was they created this, you know how they work 111, they create a kind of a screen questionnaire where, the patient's howling in worry, and he's asked this question. And the key point here is, what is the Chief Medical Officer, Dr. Kendall, telling them to say? Supposing they ask, what is the likely extent of the problem? They say, I'm a patient, I had a transfusion, I want a hepatitis C test, I think. How much danger am I in? The question is given. And this is if pressed. This means that the person's been on the phone begging for a test for quite a while already. There are 2 pages before here of questions. But they finally popped the big question, what is the likely extent of the problem? And the answer that the 111 person's ordered to give, we can only give an order of magnitude which shows the risk is very small. Based on the best information we have, it appears that 1 in 2,000 UK blood donors may carry the virus. Now, this is just even worse lying. You know, we've gone from sort of them saying it's 10 times less. And now they're telling people in panic, ringing a helpline, I've had a transfusion, what's my risk? No one's saying, well, it was 1 in 30, it was 1 in 40. The truth, they're now saying it's 1 in 2,000. And if the person still begs for a test, instead of saying, I'll give you a blood test, only to be used if someone's still on the phone and begging for help, if you are seriously distressed, you can contact your local transfusion centre and they will have someone who can talk to you. Now, you know, this is insane. You had a transfusion, you must get tested. It's quite a risk in the bad old days. We're terribly sorry about that. The truth, it was 1 in 40, so you should be checked. No, you've got a number of a transfusion centre, as if those guys are used to patient facing. I don't know. And this is a genuine document. It's what they did in 1995. And my point is, this is only 5 years after They've done thousands of blood tests, knowing it's 1 in 40 transfusions were infectious. And here they are with a helpline saying it's 1 in 2,000. It's gone from let's vanish it 90% to let's vanish it 96%. And this, of course, it was the departments of health. So again, Kenneth Kendall, Dr. Richard, I think it's Kenneth Kalman. Dr. Kalman was running the Chief Medical Officer of the United Kingdom, and Dr. Kendall's Department of Health, Chief Medical Officer for Scotland. But they've signed these things. So I'm sorry, again, they need to be arrested. Fingerprints, handcuffs, photographs. Why did you sign a document that will lead to the death of so many infected, innocent patients? You might be exonerated, we might just decide that you're an idiot that signed something you didn't know or understand, but we need to ask why. Thousands and thousands, tens of thousands of people have died because of these lies. The British public have a right to know why our Department of Health effectively vanished a deadly pandemic. And the infected blood pandemic is huge. It kills more than malaria. How can we not know about it? And this finally brings me around to the current whitewash. This is my third infected blood inquiry. And for the third time, they've simply refused to publish the evidence they have in hand. The Ortho Report was evidence printed and held at the Penrose inquiry. The Ortho Report is evidence printed and held at the Langstaff inquiry. When Andy Burnham attended my seminar, hosted by the Chief Health Whips at the House of Commons, I remember talking to him about the industrial scale, the vast numbers infected by this disaster. And he asked for the inquiry on the basis of it being an industrial scale cover-up. And yet, we've spent 80 million in 4 years so far. And the scale of the disaster has not been mentioned once. And the reports have simply not been on News at 10, not been on News 9 Panorama, and not been on the front pages of our dailies. So no one's got an opportunity to think, I've had a transfusion, I must get tested. We're saving no lives at all. And nobody's heard the term industrial scale 400,000, which is what the transfusion service spent 5 years knowing and working and testing and proving and fighting. No one's heard that they estimated that 2,000 people would approach end-stage liver disease a year. Yeah, that's 20,000 people in the 90s alone. I remember asking the inquiry, look, you've overlooked all the healthcare migrant infections who are now the #1 group dying of the cover-up. And I remember the inquiry saying, oh, we forgot them. Now, I can understand you saying that in 2019. But to still, well, we can't be bothered to remember them. Even now, they're not involved. We forget about them. This is racist. You know, it's an infected blood inquiry. We don't say, oh, you got COVID in Mallorca, so we're not interested in that. No. This is crazy. It's our infected blood. It's walking around in London. We're having an inquiry and they're walking past the front door and no, they're not there. We don't talk about them. This is racist. And, you know, the purpose of an inquiry is no one is left behind to die from a cover-up, isn't it? Just as a thought. And then these cover-up numbers are published weekly. Every week since 2018, I've seen the number 5,000 or top back 30,000. I've never seen the real numbers, not once. And all this time, the inquiry is sitting with these documents and refusing to put them on Newsnight, Panorama, the front pages, News at 10. So no one can realize there's a pandemic, we need to be tested. So, you know, these two reports, the Gunsons report, the Ortho report, there are human rights to know. And two statements from the head of the transfusion service tell us more that we need to know than any other statements. It's that simple. And just to cover up, this is our current inquiry's press release to the BBC for the last 4 years. 30,000 potential number of infected. Hang on, you know, they admit their own stats team hasn't worked out a number, and yet they're publishing this ridiculous number. It's insane. That's not an inquiry. That's whitewashing a cover-up. Estimated 2,400 deaths. Well, no. The transfusion service estimated more like 20 to 40,000 deaths. They've messed about with 10 million bits of paper, but the only two documents that matter are still hidden in this file. And they've got 200 people working for them, but I want to suggest that to date, Jason Evans has done more freedom of information requests to highlight who's not wanting to tell the truth and release documents than our 80 million inquiry. Jason by himself has pushed more inquiry to find more evidence, and yet he's not paid by people. Similarly, Andrew Evans has created over 20 years perhaps a more potent and detailed timeline of factor infected blood product history than this inquiry. And yet again, they're not including him or paying him. And his work is fantastically detailed. And similarly, Bruce Norval, his brief testimony, incredible the doors he opened. He explained, oh my goodness, a mainstay of the supply was addicts and prostitutes from British prisons. What a bombshell bit of evidence that's been ignored, not published. He brought up the fact that vaccinations were made out of human blood. Millions of people being given other people's blood. Research-wise, Bruce opened all these doors, not paid by the inquiry. The only person we've got being paid by the inquiry are fundamentally lawyers. We've got a judge with no scientific advisors listening to medical information that he's like, what's Hep B? It's another world we live in. So to close off, the Ortho Report, 20,000 blood tests proving UK donations were 1 in 40 transfusion Hep C infections. And the entire transfusion service knowing that fact and lying about it. And the Department of Health doing the very same thing. So please, on the 9th and 10th of December 2021, when they investigate Dr. Harold Gunson's life, please, God, can they just go through the Ortho Report and admit 300,000-400,000 Hep C transfusions did happen. And these people were left infected in 1990 to die as soon as possible with lies. And those lies, we have the signatures of all the individuals that sign them off. And you can't work in a transfusion centre doing 20,000 blood tests and a couple of years later sign off that they're 10 times better than they were. That is really what we have to ask ourselves. How do we end up in a country with a system can do such a thing? And if we don't find out this fact, it will happen again. Thanks very much, and